People have faced a lot of back issues, spinal issues, and we have a lot of problem when we see the patients regarding the back issues. My name is Dr. Abdul Ghafoor Sajjad. I am Associate Professor and Head of the Physical Therapy Department. Back pain is a common problem and most of the people think about to go for the surgeries. Today we discuss some surgical treatment interventions, the post-surgical rehabilitations and some of other conservative management of back pain rather than surgeries.
In the realm of spinal health, where precision and expertise matter most, we explore the intricacies of spinal surgeries. Join us as we gain insights from a renowned spinal surgeon dedicated to demystifying these procedures. Meet Dr. Abdul Ghafoor Sajjad, a leading expert in spinal surgeries, here to guide us through the complexities and advancements in the field. What inspired you to specialize in spinal surgery, and how have you witnessed the field evolve over the years?
I face a lot of patients from the back pain. That thing inspired me to think about that and search about that what will be the quickest remedy to avoid back pain from the pupils. So my inspiration is that to relieve the patients, which every second patient which have a spinal issues. Most of the time when we see the patients and we see that there's a problem regarding the disc and the spine and the other issues, so I think that create any further treatment strategies to solve this problem.
Can you provide an overview of common spinal conditions that may necessitate surgical intervention?
We have a lot of spinal issues which need the spinal surgery. The first one is the trauma, when you got any spinal fracture. The second one is the disc issues, and the third one is that some inflammatory spinal disease such like a caries spine and the TBs. And some of the time some shortening of the spinal canal, this is called spinal stenosis, and the multiple nerve involvement, the narrowing of the neural foramina which required spinal surgeries.
Could you walk us through some common types of spinal surgeries and the specific conditions they aim to address?
The common spinal surgeries include laminectomy, the discectomy, the spinal vertebral fusion surgeries, the artificial disc insertions, and opening of the spinal foramina.
How does the diagnostic process play a pivotal role in determining the necessity and approach for spinal surgeries?
When you have a back issue, the diagnostic is very important and very important role because of you are going for the surgeries. The gold standard in the diagnostic is the MRI other than our clinical assessment. During clinical assessment, the first question is tell me about your bowel and bladder conditions. The second thing is the radiation, the pain is radiating in the node. So the third thing is your muscle condition, your posture and your back pain.
How have minimally invasive techniques transformed spinal surgeries, and what advantages do they offer for patients?
We have a latest advanced surgery option available in minimal. The surgeon make a hole in it and put a camera to see the condition and put the small surgical instrument in that hole. This is the minimum spinal surgery. We also go for the GPS guided surgeries in the minimum invasive procedures.
What are the key considerations in post-operative care, and how do you guide patients through the recovery period?
This is a very important question. The rehabilitation and recovery process is very much important because you can lose all the surgical benefit after the surgical if you don't go for the proper rehabilitations. The first one is to strengthen your muscle. The second thing is to mobility of your nerve. The third thing is the alignment of your spine, and the fourth thing is your posture correction. But if we go for the proper rehabilitation after the surgery, we can get the maximum goals after the surgery.
As we conclude our exploration of understanding spinal surgeries, we express gratitude to Dr. Abdul Ghafoor Sajjad for his dedication to spinal health and the countless individuals whose lives have been positively impacted.